Thank you, Nabila. Thank you. Thank you, Doctor, for joining us.
Yeah, thank you. Pleasure.
As journalists, we often meet politicians, and there are some politicians who are different, but there are some who are completely flabbergasted us, even seasoned journalists. One of them is Dr. Arun. How is he different as a young doctor? He's worked in rural Tamil Nadu in Krishnagiri. He's seen at the grassroots level what are the challenges before common people, before healthcare professionals. Then, as a civil servant, as a part of the Indian revenue service, he's done sterling service there, and then he quit his revenue service at the peak. Just as his career was budding to join politics as part of Mr. Vijay's TVK, fought the elections, won the elections, and has become the health minister. In 1 year of politics, he's become one of the top individuals in the government of Tamil Nadu and is handling a very sensitive portfolio. First question, Dr. Arun. This transition from a doctor, I'm sure you must have been asked this question, but from a person who's seen this, been there, done that in health, to a revenue service officer, to a politician, how has the transition been, and which one is the toughest of the jobs?
First of all, let me begin with a deep sense of gratitude to the people of Tamil Nadu for giving us this mandate. Okay, the people of Tamil Nadu, this mandate was secured under the visionary leadership of our Honorable Chief Minister, Thiru C. Joseph Vijay. This is not yet another electoral victory. It represents the hopes and aspirations of millions of youth, the trust of all the family members of this Tamil Nadu for a clean, transparent government. So this mandate has given us enormous credibility. Previously, governments were won based on money power or muscle power. This government was won. This mandate was won based on a promise, based on the promise of clean, transparent government. And this, as I said, this gives us enormous credibility, and because of that, it gives us huge strength. At the same time, this gives us huge responsibility also. So, under the leadership of our CM, we are fully focused and fully geared up to fulfill the aspirations of the hopes of the people of Tamil Nadu. Coming back to your question, yes, as you mentioned, I was a trained doctor by profession. Then I entered into civil service. Then I quit, and now I'm into politics. The first thing I learned in medicine is empathy. This is the thing every doctor gets trained, because once we know the pain of the poor, pain of the sick, then the words and the language we speak to them, it heals half of the disease. And also, I happen to work in a remote village in Krishnagiri district. And by that, I had the unique opportunity of knowing what exactly is the problems of a rural poor who tries to access the healthcare. He looks upon a rural doctor for want of a health service was looked upon as a sort of mercy from the doctor. Not as a matter of right, but as a matter of a mercy or a kindness from the doctors or the treating staff nurses. At the same time, next when I entered into civil service, it gave me huge administrative experiences. One of the fundamental principles in administration is that no one is indispensable. System is always bigger. So all these things have come in handy when I'm handling now this health ministry. So definitely it gives me an unique opportunity and unique strengths to handle this very sensitive ministry of health.
So Tamil Nadu has been known as a state. Yeah, please go ahead.
You asked me which is the toughest of all the three. Of course, politics is the most tough one, because see, we are always in the limelight for right or wrong reasons. Being in a bureaucracy, it gives us huge security, both professionally and also from every other aspect. But here we are always in the limelight. Any small mistakes just gets flared up, and we are answerable to the people. We have to look after our constituency, and also, as I had earlier mentioned, this hopes and expectations of the people of Tamil Nadu is huge. So we have this huge responsibility to fulfill those are expectations.
So the burden of all the hope which is coming from the people of Tamil Nadu, the big challenge. But traditionally, Tamil Nadu is known as a state where bureaucracy is very strong. Traditionally, Tamil Nadu is known as a state where healthcare system is quite robust. I mean, you've done well, whether it be primary healthcare centers. What is the next big challenge for you?
As you mentioned, Tamil Nadu is one of the better performing states as far as healthcare is concerned. Now, time is ripe for the next big leap in healthcare in the state of Tamil Nadu. So, under the leadership of our CM, we have some 5-6 core areas which will form the focus of our governments. And I would like my tenure to be judged on these aspects. First is to bring specialist care to the rural and district hospitals. Presently, that access to primary health care is almost reached. Now, this next challenge is to bring specialist care at the district level, taluk level hospitals. Second, this cancer care treatment. If there is one diagnosis which can shatter the family, both physically, emotionally, and also financially, it is the diagnosis of cancer for any member of a family. Now, we have a comprehensive CM health insurance scheme, but many times this cost of the treatment is much bigger than this coverage. So we want to expand this cancer care network to every district. And third, another unfocused area previously has been mental health. Mental health problems is one of the, as per WHO, 1 in 7 persons across the world, they suffer from one mental health illness or the other. And it is the second leading causes of years spent with disability. So our government has recognized this need, and I think this is going to be a first step in improving mental health among the poor. And apart from this, I would also say our government has special focus to improve the positive health among the people. See, all along these priorities of this government have been towards treatment, building new hospitals, buying latest medical equipments. All these were treatment oriented. Sufficient, I would say, this sufficient focus was not given to preventive aspect, primordial prevention like. So under the leadership of a CM, we want to give more focus on promoting positive health among the people, right from dietary advice, what foods not to have, and also this daily exercise routine. When we see many Western countries being fit and following daily exercise routine is part of their daily routine. Even if they come late, they don't tend to miss their routine. All these things we want to promote so that positive health is promoted among this community. And lastly, I would say we want to improve patient experience in a government hospital. Just like that people go for a shopping and that experience is measured, we want a patient's experience in a government hospital to be improved, starting from this waiting time and the cleanliness and the ambience of the hospital, to the quality of the restrooms, the neatness of the restroom, the cleanliness of the restrooms, and the provision of proper drinking water facilities. All this we want to focus on so that overall patient experience is improved.
Yes, this may look very basic, but of course it's extremely important. But going back to one or two points that you said, one is the tobacco ban in Tamil Nadu, which has been quite effectively done. Pardon? Tobacco ban, the ban on gutka, the way you have banned it and the way it's been carried out by the government, that is exceptional, the way it's part of your healthcare program also. Second is mental health care that you spoke about. Some of the pictures, for example, when one watches TV or social media, some of the most scary pictures come when you have this unrequited lover killing the lady. All these things are outcome of a society where there are issues which have not been addressed. So these two are interlinked, whether it be of abuse of substance or of people acting in certain manner. So aren't you focusing specifically on these two issues?
Definitely, drug abuse is one of the key reasons for crimes, and especially crimes against women. So that this prevalence of drugs has increased in the last 5-10 years. It's because of poor implementation of law and order in the state, and also not giving the due importance it deserves. So one of the first things our government did was to appoint a regular DGP, which the post of which was vacant for nearly 2 years in the previous regime. And also this crimes against women, which you mentioned, they have to be addressed in a more holistic manner. See, right from school, we have to teach our students to respect the opposite sexes. It's not that just like having a relationship, and it's not a matter of right that other sex, they have a right to say no. We have to respect the decisions. All these things have to be cultivated, and they have to be taught right from the school ages, and that's how these kind of incidents can be prevented.
As a journalist, I cannot but ask you a political question. As a doctor, you have passed the NEET exam, not the entrance examination. You've been through that rigmarole, that challenge. Now you have students protesting on one hand. You have the government of Tamil Nadu, which has a slightly different approach towards a common entrance examination. What is your reading? What is your solution to the challenge?
See, India is a federal country and also a very vast country. So lakhs of students take up this entrance exam for this medical admissions. See, our party, even before these elections, have taken a very consistent stand that let education and this medical education and healthcare be brought to the state list. As a federal government, it has enough things to do. Let it take care of this economy, defense, communications. Let it do it more effectively. Let these things be handled by the respective states. See, conducting one exam, one common entrance exam for this lakhs and lakhs of students across the length and breadth of the country, it's definitely challenging for any government, any party which is at the union level. So why have this great inclination and great stubbornness in saying that it is me who will conduct? It is one agency which will conduct an entrance exam for the entire length and breadth of the state, because every respective states have taken great pain and efforts to establish medical colleges at their own cost.
Counter to that, doctor, you also passed the civil services.
Yeah.
MBBS you passed, civil services you passed. The union public service examinations are very well conducted by the union government. There has never been a challenge to that. You cleared that also.
No, I would respectfully disagree because you should ask a lot of UPSC aspirants about the credibility of UPSC. Let me be very fair. Okay. See, for a job at a corporate, we have multiple levels of interview. First technical interview, HR interview. Here in UPSC, the final stage of exam is the personality test, which is commonly referred to as interview. There 5 members sit and they decide the future of the nation by selecting or not selecting a particular candidate in 25 minutes. And that too, that decisions being taken in the UPSC panel is not democratic. That board chairman has the overriding authority to override the marks awarded by other members of the board. Secondly, there has always been an accusation that the candidates are called for during that interview process according to their community. First, general categories are called. Next, OBC candidates are called. Next, SC candidates are called. Then ST candidates are called. If you see the average marks scored by the general category, OBC, SC, ST students, there is always a gap. So the thing is, the board knows which community the candidate belongs. So the top performer of OBC and the equally top performer of SC, they don't get the same marks. This bias is always there. This has been written and talked about by lakhs and lakhs of students over the years. This is not, this issue of the problems in UPSC scheme of things is not restricted to this interview alone. Even in this mains exam, there is a system of grading or normalizing marks. See, we have some 22 different optionals. Maybe in a particular year, geography may be easy, and some other year, political science or public administration may be easy. So they have a system of normalizing marks. See, this is all not transparent at all. And I had put an RTA when I had got a very low marks in one of my attempts. I had put an RTA whether this double evaluation system is followed. Because why I asked is that my own mother was working in college. She was a college lecturer, professor, and she used to evaluate the mark sheets without awarding marks. She used to put it in a separate sheet of paper. I asked why. She said, I along with another evaluator would evaluate the papers, and an average would be taken. If the difference is more, it will go to a third evaluator. So why can't this system be followed in a very highly important exam like civil service exams? So which decides who will be this bureaucrats of the state. So definitely UPSC also needs reform. I want to make a strong statement from this stage.
Thank you, Dr. Arun, there for your kind words. Dr. Arunraj, the Minister for Health, Medical Education of Tamil Nadu government. Thanks a lot for joining us and giving us your time.
Thank you.